All right. Looks like we are over 600 strong. Thank you all so much for joining. I'll kick it over to Chelsea to get us started with the introductions.
Thanks so much, Amanda. And thanks everyone for joining us today, this afternoon webinar. We're really excited to have you and talk about this timely and important topic. I'm so grateful for all of you for being here with us. As Amanda said, I'm Chelsea Cipriano. I'm the Managing Director of the Common Health Coalition, which is an organization that we created to improve partnerships between healthcare and public health. We're now at about 250 organizations strong. So if your organization, if you're listening and that sounds of interest to you, it's free to join. Would love to have you, and we'll put information about signing up in the chat. I'm here with our team today, including Dr. Dave Choksi, who's our chair. You can see him here on screen. Rebecca Giglio, who's our deputy director, and will be in the chat, dropping links as we go, and several others who are off camera. But we're here just grateful for your time, grateful for this amazing group of panelists and experts who we've gathered here today, and excited to hear what they have to share. So thank you. And Amanda, I'll pass it back over to you for a quick intro.
Awesome. It's great to see you all. A few folks here from the PHCC community. But for those that are not familiar, my name is Amanda Kwong, and I'm the director of the Public Health Communications Collaborative, which is a resource and information hub that got its start back in August of 2020. Got its start with a couple of partners in the public health communication space, including the De Beaumont Foundation, the Kresge Foundation, and Trust for America's Health, as well as the CDC Foundation. We're 40,000 members strong. We have a monthly webinar series. We have various messaging and talking points, social graphics that are free for you to use and download and publish. Measles has been a really hot topic for us. I cannot tell you how many times we've been updating our talking points, making sure they reflect the latest stats and figures and tones in a way that we can really think about how do we compel people to understand measles in plain language, and think about and talk about what's important for themselves and for community members when protecting themselves. So excited to be partnering with the Common Health Coalition with Chelsea and her whole team. And thank you all so much again for joining.
So I think Amanda covered it. It's pretty self-explanatory why both the coalition and PHCC are interested, passionate about, and working on preventing the spread of measles in the US. And we bring our members and our many experts behind the scenes to the table in doing this. But the important part of this is all of you, and how we really translate everything we're talking about on the public health, healthcare, practitioner side into action that matters for our communities, for keeping people healthy, and preventing the spread of a dangerous disease. So we're here today to talk about that. I will do a very, very quick round of introductions of our moderator and our incredible speakers, and then I will pass it over to Todd Wallen. Great. So our moderator today is Dr. Todd Wallen, the Executive Director of the Trusted Messenger Program, which is part of the Public Good Projects, which is one of our partners as well. So thank you, PGP. He is a pediatrician and recognized as a national advocate for vaccine communication and clinical support, clinician support, with deep expertise in countering misinformation and threats to public health confidence in measles immunization. Dr. Simbo Ige is the commissioner of the Chicago Department of Public Health. Throughout her career, Dr. Ige has championed approaches that center communities in public health work, an approach that has proved vital during the COVID-19 crisis, where we worked with her in New York City, and again during Chicago's recent measles outbreak just last year. Dr. Catherine Wells. Catherine is the director of the Lubbock Public Health District and former Texas State Communicable Disease Manager. She brings extensive experience coordinating regional measles response and immunization strategies across public health systems, and of course, is now currently countering the measles outbreak in Lubbock. Dr. Jess Hackle is the chair of the American Academy of Pediatrics Committee on Pediatric Workforce and a leader in pediatric practice and communication, vaccine communication. And finally, Dr. Caitlin Jetelina, who you may all know as your local epidemiologist on social media and her Substack, and is a leading voice in translating science and combating misinformation. Her widely read newsletter has become a trusted source of data, information, and communications wisdom for many, proving especially vital now during the US measles resurgence. You can read more about their extensive experience in the chat. Rebecca will drop these bios into the chat so you can read more. We won't spend too much time. I'm gonna get to their actual, what they have to share with you, putting all this expertise into action. We'll also share a link in the chat, some housekeeping, to the resource page that we prepared specifically for this webinar with measles-related resources sourced from these speakers and others, and from PHCC and the coalition. So that will all be in the chat. If you're not monitoring the chat, these will also be on our website at commonhealthcoalition.org. And we are excited for you to dive in and also share resources with us that you may have that you think would help others in preparing and responding to measles outbreaks as the outbreak spreads across the country. Okay, with that, Todd, I am going to pass over to you and we'll get into the conversation. Thank you so much.
Yes, thanks so much. And I'm honored to be the moderator for today. I'm going to start jumping right into this because I want to keep us on time and we got to make up a little bit. So here we go. We're going to give a brief overview of the importance of communication in managing measles outbreak. But first, let's go over some numbers. These are coming from Yale's VMOC, which is their virtual medical operations center. So as of Sunday, they had in the Southwest alone 880 cases. CDC has 1,046 reported as of May 22. We're seeing potentially a little bit of a slowdown in Texas, but we do have outbreaks in other states, including New Mexico and Oklahoma. And if you add up all the states, I think it's about 30 states, and then New York City is a jurisdiction, so 31 total jurisdictions. There is also concern about an undercount in some areas as well. And there are some predictions as high as 3 to 5 times greater cases than we're currently seeing. And there is some predictions that this could be lasting up to throughout the year. The Common Health Coalition features the reports from Yale that I just mentioned in their weekly digest, the 242 digest, and on their website. And we'll put the link in the chat for those to register for the digest as well. So you already heard some introductions that were provided earlier, but I'm going to ask each of you quickly, each of you to give a brief intro. And what I want you to say is a little bit about your role and what you see as a driving your perspective on the issue related to measles, either personal or professional, but you each have less than a minute. So I'm going to start with Dr. Ige.
Hi, everyone. I like to say my expertise is in representing the perspective of those who have had bad experiences with the system. Working with those who are concerned about their safety and working to engage communities that have been in the margins. And trying to be as relatable as possible. So that is the perspective I bring to the conversation. A Black woman in America navigating systems that have not really put the health of people of color at the center.
Thank you. Dr. Wells.
Good afternoon, everyone. Yeah, I think my perspective, initially it's really because I'm the lucky one that ended up with this measles outbreak very close to the health department I run. But a lot of our work locally is about, building bridges between our healthcare system and our public health system and our social services system here in Lubbock. And kind of my immediate work here is really around the response and talk a little bit about what we've done, what's going well, and some of the mistakes we've made.
Thanks very much. And Dr. Hackle.
Thank you and good afternoon. My experience is that of a community-based pediatrician in a suburb of New York City, where we had to deal with a good part of the 2019 New York outbreak. So having some personal experience on changing communications over that period of time is where I come from. And my perspective is making sure that recommendations and guidelines are readily implementable on the front lines among the pediatricians and the clinicians in the offices who have these conversations with parents on a daily basis.
Thanks. And Dr. Jetelina.
Yeah, good afternoon, good morning, everyone. Caitlin Jetelina. I come at this with many different hats. I think the most dominant hat that I wear, though, is that I'm a mom of a 4 and 5-year-old and have immense empathy for all the parents out there trying to navigate this really confusing storm online of what is true, what is not true, really having a hard time finding answers to my questions for my girls. And so that's how I approach this moment, as well as a lot of these measles outbreaks that we're seeing right now.
Thank you. Yeah, and as a pediatrician who now has gone full-time to nonprofit healthcare communications work, I share all the concerns you guys have brought up. And, there are a range of narratives that are out there that we have to deal with, like, oh, measles isn't a big deal, or it's always mild, or vitamin A is good for it and it can prevent it. And we know that there's a lot of factual information that's necessary to help our patients and our communities steer through this. So, all right, let's go for our first question, and I'll switch to first names. Let's make it a little more informal. So, Simbo, my question for you is that just last year, Chicago faced a large measles outbreak, and under your leadership, you guys were able to curb this spread. So, what prior experience did you reflect back on as Chicago navigated communicating about the outbreak with the public? And is there anything you wish you had known going into that experience that you now know?
Well, thank you, Todd. So like I said, my experience is really working with those who are very skeptical of the system and, whatever messaging is coming out. So when we were notified that we had a confirmed measles case in a shelter that was mostly had immigrants in that shelter, exposure to 2,500 plus people at once, my immediate reaction was like, this is going to be a communication nightmare. How do we convince people? And we had recently lost a child from some other reasons. Convince people who have been, well, not always prioritized, and people who have felt like, the system didn't put them first, that we were now centering them, that their needs had now become a priority for us, and convince them to get a vaccine. So in all the work that I've done around routine immunization for over 25 years, vaccines are no good if they cannot become vaccination. The challenge is not just in the vaccine, it is in convincing people or persuading people that these vaccines are good for them. So I realized that that was going to be my biggest challenge, and that I had to be convincing. I had to be able to convince people that I genuinely cared about them, for them to accept these vaccines. So I had to be there in person. I had to invite people who were already trusted, the priests, the council members who had been advocating for the needs, the community advocates who had worked with them when they arrived, the people who donated the shoes, the people who donated clothing, the people who had already demonstrated that they were concerned about their well-being, and convince those people first why this is important, because we had to vaccinate everybody within 72 hours. And we had to start with listening, because it was very hard. Our doctors, the nurses were all sitting there. Nobody showed up for the vaccination. So the work was really in helping people understand and believe that we were genuinely concerned about their well-being. And that manifested in many different ways, including people's concerns about being able to go to work, people's concerns about what will this mean for my children? Is this necessary? Are there other things I can do instead of this vaccine? What are the side effects, etc. But what we found that people were most worried about is, do you really care about my well-being? And can I trust that this thing you are offering is really good for me? And you cannot do that when you don't already have a relationship with the community, when they don't already trust you. In that moment, it is important to leverage the relationships that are already exist. And with time, you build that relationship. And with time, they could trust our providers over time. So that, and what I will like people to know in this situation is that we have come from a time when I am a doctor, I have all these degrees, I am a pediatrician, I have done this for 20 years, is no longer sufficient. People now want to know, do you care about me as a person? And so if there's someone who has offered me some water or shoes or shown some interest, I trust them more than I trust you. And I think that that is the area we need to navigate as experts, as professionals, as providers. It's a very different operational context than before.
Yeah, I thank you very much for that answer. The trust in the messenger, absolutely core to my work as well, and I know everybody else's work. So that's, yeah, just completely on point. Thank you. Let me switch over to Caitlin, and here's a question for you, which is that a lot of your work revolves around finding new ways to package health information for the public, and importantly, listening, as you've pointed out, to what people really need and reflecting on what public health and healthcare should be doing better. So, for those listening and those of us here, tell us, what do you think needs to be done better at this moment? And how can public health make our messaging land with communities, particularly those that aren't yet in the throes of an outbreak right now?
Yeah, well, I think you're going to hear that a lot of my themes follow Simbo's, and that's why I'm such a big fan of hers over in Chicago. But, I think, this is the reality right now, is that we are not just going to message our way out of this moment with some slogan or viral campaign. And it's certainly not with finger wagging. It's very clear that era is over. We are now in this age of what I like calling a curiosity-driven class that has been unleashed, that millions of people have really real, thoughtful questions about their health, and they want nuance and they want to understand. And they're also looking for that information. But the challenge is usually when they're looking for it, they find an information void, which is often filled with a lot of falsehoods or rumors. And so I think if we want our message to matter, especially before communities are in crisis, we really have to rise to this moment. And I think that means doing three things better starting now. And this is, again, what Simba really messaged on, but was one, we have to build relationships, yeah, during an outbreak, but preferably before one hits. Trust is the foundation of effective communication, right? And trust is not declared, it is earned over and over and over again. And so your message will just not land if the person hearing it doesn't trust you. So right now in communities that don't have outbreaks, the time we need to ask right now is, who in your community is least likely to be vaccinated for measles, right? Is it migrant families? Is it faith-based groups? Is it suburban parents? And who holds the most influence in those communities, right? And it's usually not even the public health department. Maybe it's school nurses or a Facebook group or barbers or librarians, and you go to them and listen first and ask what concerns they're hearing and try to understand their world, because this isn't going to be a one-way broadcast. It has to be a relationship. And that relationship building takes time, it takes transparency, and it takes follow through, actually acting on what you're listening to. I think we can also anticipate questions and then answer them from a place of empathy a whole lot better. In public health and even in healthcare, we're always in this reactive mode. We have to get out of this reactive mode and be proactive. People have questions. And you don't need $1 million campaign to understand what those questions are. I created an FAQ at YLE back in November, written in plain language, but it's very powerful. We built it off around routine childhood vaccination questions, and it was downloaded more than 50,000 times through YLE and is being used by community health workers, for example, on house calls or business leaders that their employees have questions around. So always ask about what are the most common questions of people in your community that have about the MMR vaccine. It's not going to be the same across all communities, and who are those trusted messengers, and figure out how to partner with them and not before or during an outbreak. The second, I was going to say the third is that we really need to be better at communicating risk with clarity instead of alarm. Right now, the risk of measles, it's not widespread. It is very real, though, for specific groups, unvaccinated children, pockets of underimmunized communities, and infants really young. And we have to get better at communicating that risk accurately as well as empathetically, right? A lot of people right now are worried, even though they are fully protected. That means we in public health are doing a poor job of communicating that protection. And they too still have questions, right? We have to engage with those that don't have enough information and then respond to these real questions that people are having, right? If natural infection is better, if you need a booster as an adult. It's really hard to find answers to those questions for in the community. I think, I know, I don't know, I think my time is running out, but the last thing I just want to highlight here is that like this takes time and investment. Effective communication is not passive. That means it takes leadership buy-in. It takes, again, investment. It takes intention. And it's not a side hustle. A lot of the time in public health, we're taught that communication is like this ugly stepchild on the side, but that is just not the case. I mean, we really have to take this seriously. And we can do it innovatively too, right? Use my chart systems, not only to push out, but to collect patient questions, hop in comments in the social media accounts, empower staff with FAQs, find even the chief gossiper in your town and bring them into the fold, right? They're already shaping a lot of community perception. So I guess my message around the messaging around measles is that we don't need to be louder, but I do think that we need to be more present. We sure have to be a whole lot more human and try to get more proactive. And that's how we get ahead of measles before it really hits a place like West Texas or Chicago.
Thanks. Yeah, I couldn't agree more. Being as a healthcare provider, being authentic and also being timely in our responses to our communities, but spot on again. Okay, Catherine, this one is going to be for you. And the question is that Lubbock is in the middle of the outbreak, ranging in the southwest of the U.S. So first, I think a lot of people are wondering how you holding up. And then the second piece to that's going to be talking about healthcare as a critical partner to curbing the outbreak, right? I love that the Common Health Coalition brings together both healthcare and public health. But the role of healthcare in curbing the outbreak, and what have you found to be the most effective communication strategy with healthcare clinicians? And what would you advise other jurisdictions to do that are preparing now if they don't yet have measles cases in their region?
Well, first, thank you for checking in on me. It's been a wild, crazy 4 months, and anybody out there that has a local health department director that's responding to this in their communities, check in with them. It's a challenge on many different fronts. I always say public health can't just happen with what goes on in my specific department. Public health department directors really need to get out from behind their desk and involve themselves in the communities they're serving. And we can't respond. I mean, I can't stop the measles outbreak on my own. it is working with those providers, and especially with measles, it's focusing on the pediatrician community and our family or family medicine providers out there, because they're the ones that that are providing those vaccinations. We can't provide those vaccinations, enough of them, through the health department. A lot of questions early on from our medical providers when measles started. We hadn't seen a case in 21 years. That means that we had educated an entire, probably 2 generations of physicians in our community that had never seen measles. So the most important thing, I think the best thing we did early on was we started a provider call that was open to providers, nurses, office managers, anybody in the healthcare setting. Media wasn't allowed on that. Had a very frank, open conversation about what we were seeing, what their questions were, and what we needed to develop to make their jobs easier. So that was number one. Second one was getting very standardized guidance in our community. There's little differences between the Red Book and CDC and the state. And we actually got together some of the leaders of our physicians groups and actually sat down and said, these are going to be the guidelines for Lubbock. We're all going to follow them, so that we were giving the right messages to the patients. And then the last one was making sure public health was available to those physicians. So we opened up a hotline very quickly that was staffed by multiple kind of epi and some other people that do contact tracing and investigations. We trained them up very quickly, and we're there to answer those provider calls. And then I guess for things that health departments and communities can be thinking about as you're preparing is make sure you have that standardized guidance. And then also, your physicians and your medical community can also be your communicators, especially when there's things that you can't say as a local health department director. So know who those good physician communicators are in your own specific community. Make sure they have the clearances to speak to the media, make sure that they have some talking points, and use them to spread the messages to the community.
Thank you so much, and glad you're still in one piece. So the next question is going to go to Jess. I must divulge, a fellow AAP friend of mine. So Jess, as chair of the American Academy of Pediatrics Committee on Pediatric Workforce, what are you hearing from physicians as the most necessary resources and tools right now, either from AAP or from public health departments? And how are you advising practices and practitioners how should they prepare for what's potentially to come if the spread continues into their region?
Thanks, Todd. The first point I would make is despite everything that's gone on over the past years, parents still do consider their pediatrician their most trusted resource for information on their children's health, which includes vaccinations and other preventive measures that we can take. So we're sort of starting as pediatric clinicians, we're starting from a slightly elevated area, but that's not a laurel, that is a call to action. We have the access to our patients, and we need to be using that access to make sure that we communicate. The AAP has a number of resources and tools that are available for both pediatricians and for the public, and we'll link to some of those in the chat. And these tools are excellent, giving ways to discuss the vaccines, background information on the vaccines, and things like that. But we need to use these tools. We need to communicate. Obviously, we need to use the tools to communicate with our parents, the parents who bring their kids to us, but we also need to communicate with our colleagues. We should not forget the family practitioners, the internists, even the OBGYNs in the community, who also are now becoming more proficient at vaccinating in general, because they can be resources to share communication and to share information, even if they're not giving the specific vaccines themselves. Let's not forget the pharmacists, who also do a tremendous amount of vaccination in many communities, especially in the rural communities where it may be more difficult to reach a pediatrician. So we need to communicate with them and share our information. We have to remember our partners, obviously the local health departments, but our school nurses are a huge partner. in the drive to have kids vaccinated. And having a relationship with the school nurses in your community is a really good tool to use to make sure that we're coming from the same position when we talk about vaccines. Then there are the faith leaders and the other community leaders. Many of us may not have direct contacts with them, but through the health department and through other community-based organizations, we can be involved in other community events such as health fairs and things where we bring pediatric knowledge to the community. As Simbo was saying, interact with people in the community, people who are different from you, and show them that you care about them, about their community as people. Because then when you need to get a message across on a more urgent basis, you start to have the cred that gets you access. What we still need, I think, and this is not through anybody's fault, but what we still need is really good, effective tools to be able to counter all of the misinformation and disinformation that's circulating. It's very hard when a piece of misinformation gets a head start on social media. It's very hard to be able to counter that in an effective way. And so we need to make sure that, number one, we know the facts. But number two, we know why that information is spreading so readily, why parents are so eager to take it up and at least consider it, even if they don't totally believe it. So it's important that we listen and hear what the buzz is on social media, both the positive supporting vaccinations as well as the negative misinformation and disinformation. If we're aware of that, then we can understand better how to respond to the concerns that our parents express. And the one point I would make, and we've seen this in numerous studies, is that most people are not outright refusing vaccines, but many of them have questions, many of them are hesitant. But spending time with them, listening to their concerns, validating their concerns, and then providing information is a good way to bring most people who are hesitant about vaccines around to actually getting their children vaccinated.
Thank you. Yeah, I mean, each of you took time to, of course, discuss trust and all the different trusted messengers that are out there, not just pediatricians, but school nurses, pharmacists, the social workers, community-based and faith-based organizations, all super critical. The one thing I always like to point out is that public health probably a little better than healthcare, but we don't get that much communication training, if at all. And, it was in my practice that we really started taking best practices out there and training our own healthcare providers, but then also using tools that are able to reach way more people than you can just in an exam room, right? So using population communication to achieve population health. So I really appreciate each of you taking time to go through those specific questions. And I'm going to throw a question out to the group and you guys can all take a shot. So this question is going to be about, given the federal cuts that we're seeing, how can we leverage partnerships across sectors in this moment to fill each other's communications and operational gaps? Who wants to take a first shot at that one? Not all at once. I mean, you can take your time. There we go.
I mean, I'm happy to jump in. I'd love to hear others' perspectives on this too. But I mean, and it kind of goes to, maybe what Catherine was alluding to earlier, what I experienced during COVID in Texas as well, is like sometimes we're don't usually some have the ability to communicate too. So we really need to think innovatively around this, not just financially, but how to get a message across. And I think that I feel like I'm a broken record, but that comes down to partnerships in the community with other sectors. I mean, we know that the most trusted sources of health information in local communities is the local health department, but also local news, as well as pediatricians and librarians in rural communities and EMTs. And so how can we help leverage their networks and partner with them in order to help fill those gaps is, I think, the biggest way we can increase our capacity right now, and don't really have a choice. And so I guess that would be my answer to that is approach this as a whole community approach and figure out where you can partner, and be really innovative in this space. Simba, what do you think?
Yeah. I agree completely. But we also need to realize that usually the people who need the information the most are not the people seeking out the information. So we sort of have to first understand, how do we get to people who are not in the traditional spaces where we have influence? And like Catalin is sharing, we have to go meet people here. Everybody has talked about how we have to be creative and innovative around our messaging, so it cannot be business as usual. For example, in Chicago, when we were trying to do messaging, it's like these TV programs, these stations they are not the right places to get information to those who need to have the information. So we had to do engagement with immigrant groups and those who provide those services, and provide information in ways they feel will resonate. Like if you ambush people with this information, or if you show up with your van and all of that, people get anxious and, may not show up. So let us, you know, guide you in terms of when is the appropriate time to bring the information, in what spaces, at what time, in what presentation may be appropriate. So my encouragement to folks is, let's just be open. It's going to take a little bit of work and being creative in terms of how we present our messaging, but we also need to be patient. This is going to take some work. It's not going to be the easy, convenient, I hand you a flyer and my work is done kind of approach. It's going to need us being humble and willing to listen, and say and for us not to be judgmental, because it's very easy for us to say, how can you not believe these things? Um, the other thing that I will say is, whenever there's an opportunity for us to show, we should leverage that. I have found a lot of success in showing people my vaccination card, and like my yellow card and all that, and like, these are the vaccinations I have taken. Some of our medical directors will say, I work providing vaccination or seeing children with measles for how many years, and I have not gotten measles. And you know why that is? Because this is my title value. So we know that this thing is protected because we are in it ourselves. Not just that we are telling you these things, but that we have had the same experiences. We have taken the vaccines. My children are vaccinated. Whenever we have the opportunity to show, I think that also resonates really well with communities.
To add to that, what Simbo says is it's well demonstrated that a pediatrician or a clinician sharing their own experience, that they are vaccinated, their children are vaccinated, and for me, my grandchildren are also fully vaccinated. Sharing that experience demonstrates to us the trust we have in the vaccines, the understanding of the need for them and their effectiveness, and gives the message that this is what I do for my family. I could do no less for your family. And I do that because I care about you and your family the same way I care about mine. And I think that's a very powerful message that we all need to use a little bit more often to make this discussion more personal.
Yeah, I definitely feel, whether it's from the healthcare side or the public health side, right? We have different approaches and communication best practices and just engagement best practices, building upon trust, showing that you care, as Simba said, being there, right? And demonstrating the caring. All those points, absolutely. I can just, as I reflect back on my training along the years, these are things I think a lot of us have learned along the way more than what we were taught in school, about the ability to really effectively engage and educate and help the communities that we serve. All right, one more question for the group. which would be, and we may have covered bits of this, but I'll throw it out there again in this form, that what kind of hyperlocal approaches have any of you seen to be very effective in terms of messaging and resource distribution? Anything that we haven't already mentioned?
I think I'll go ahead and kick that one off. One of the things that worked really well was engaging with our school nurses during this outbreak. Early on, I sent letters to the superintendents of our school districts and encouraging them to find the children that aren't vaccinated. And we had school nurses that went through and combed through those vaccine records and actually wrote individual notes to parents home and said, this is why you need this vaccine. We're seeing measles now. Your child's not vaccinated. If they get exposed, these are the risks. And we actually had parents show up at our clinic with those school nurse letters. And that was just a great way of reaching those parents. It doesn't matter how many times I said it on the news, that note from the school nurse to that mom made all the difference in the world for that specific family. It takes time, but I'm very thankful for those school nurses and their work. Some of the other things we used was actually finding outlets through the media, but through more conservative media channels, getting on some of the like AM talk radio shows, those types of things to get the messaging out to different groups who might not be hearing the more traditional news stations.
I think that's wonderful. Again, another terrific trusted messenger, right? I mean, the school nurse, if you think about school nurse, even childcare teachers or early educators, right? They see kids way more waking hours than their own parents, so they become a very trusted resource too. So thank you for that example, though, of school nurses. I am going to throw out some additional questions here. And this first one, actually, I think Chelsea might be able to give us some info, but can you provide us with some easy to edit and share templates, measles messaging for various outlets, social media, platforms, print news, flyers? And I think everyone is using great standard messaging, but there's, can even be better if we can get the idea of standardized or templated messaging out there. So Chelsea, do you have anything to add on that point?
Yeah, thank you to whomever asked this question. I think it's a really important one about how we can take each other's learnings and resources and not reinvent the wheel if we have something that's working, which is kind of the whole ethos of what we're trying to do here. So in the resource section that Rebecca dropped, there are some FAQs and other flyers shared by all of these panelists and their organizations. We'll continue to populate that if you're listening and you think you have a really fantastic FAQ or resource that you've been using and hearing good feedback on. We would love to have it and amplify it and help share it with others. There's an FAQ in there that Caitlin developed recently in consultation with folks in the community, and I think that has been picked up and used quite widely. And then, of course, PHCC and the AAP have a lot of resources. But we're here if folks are still desiring template materials. I think that's definitely something that we can help create because we want to be useful to what you all need right now.
Terrific. Thank you. The next question's from the chat, and this one's going to be for Simbo, which is, how can we help churches and other faith leaders that might currently be speaking on a narrative that may not be as supportive of vaccines and become more receptive to supporting vaccines? How would you address that question?
Well, from my experience, those who are very vocally anti-vaccines don't readily change their mind. So I think you should prioritize those who are really curious, the movable middle, those with deeply held beliefs. It's not a good place to start. So there are those who are really curious. It's like, we're trying to really understand this messaging. Can you help us? So when you can get one or two champions from the community, not necessarily the ones who are already out there actively campaigning, because again, remember, this is about saving face. even when people are faced with contrary evidence, because they have been so vocally anti-vaccination, they very rarely openly say they now are believers. So I will say put your energy in on the movable middle, those who have genuine concerns and are really seeking answers. And if you can, again, show what we know for certain is that if you were born in the United States and you've gone to school in the United States and you went to college in the United States, you are probably vaccinated with measles, the MMR vaccines. Now, that's millions of people. So the question for us is, those are millions of people who are thriving and are well. We have done this for so many years. The vaccine technology has been around for over 200 years. So this is just not me telling you that this is good. We have hundreds of years of experience, and we know that when we don't do these things go awry, and we are seeing that now. And I say to people in Chicago, all we did in Chicago is vaccinate, vaccinate, vaccinate when we had an outbreak, and we were able to curtail that outbreak. So even if we're not using examples from 200 years ago or from 2002 or from many other countries in the world where there was measles and now there is no longer measles, and what changed the vaccination, we can show you real time that when we vaccinate people, the spread of measles stops. So I have found that to really resonate with people. And we need people to feel reassured that this is the solution. And we are not just promoting this. We're not getting any financial benefit from it. Nobody's just putting the words in our mouth. We genuinely believe that this is the best thing to keep our children and our community safe. And once you have a few champions, then they can collaborate with you and support you in that messaging. And they invite you in. They tell you, they cue you in when it's the right time to come and how you should frame it. And, so I feel that works better than going after those who are very anti-vaccination.
Thank you. Yeah, I would point two things out for sure. Absolutely. There is a very, very small minority, I think, of people that would truly fit into a category of no vaccine's good and all vaccines should go away. And so I think our words matter. And so I don't even really use the word hesitant even so much anymore as questioning, and questionings are totally good to ask, and we should be prepared to answer those questions. But another point, Simba, that you had brought up earlier that I think we've seen in smaller communities, particularly with religion in play, is being a trusted messenger to that specific community. We saw this in the Somali community with imams that were impacting that community. We saw it in the Orthodox Jewish communities, where you actually had to get people from those communities that were trusted and respected as well to be involved in being trusted messengers of accurate information. Caitlin, this one's for you. It's from an audience member, and the question says, how much information should I share with our community to encourage preventative action without triggering too much fear?
I mean, I guess I don't concern myself with fear right now. I actually think there's a lot of fear in this world. And actually, when we communicate in a steady-headed, helpful way, it removes fear from this universe. And so I always personally lean towards more of the empowerment side of things. I actually have been working with Maha the past couple weeks around specifically vaccine communication, and have learned a lot from them on how better to engage and to people want nuance, right? People don't want to be persuaded. They don't want to have it oversimplified. They just want acknowledgement of complexity and give people room to make informed decisions on their own. I think that we in public health always try to get the most simple message, most simple message, most simple message, but like that is just not the information landscape we're in right now. People want more, specifically the communities that I've been working with. Now, these are, it depends on your audience and how they want that information packaged. I think there's also this need right now, and this is what I'm hearing and learning a lot from the MAHA group around honoring very different realities that people are facing right now. That FAQ that I keep talking about that I put together, the MAHA group actually came back with a lot of constructive feedback and asked me to add a question at the end saying that if someone can't or vaccinate their family for religious reasons, what else can they do to protect their family? Because they do care about their families too. And that request really completely made me start reframing how I thought about at least the Maha audience and other people out in our community, that we have to meet people where they are, not just wish where we wish that they were. And I think, one common theme that we've heard throughout this hour is we're all talking about MMR vaccines, but that's not also the only tool in our tool belt. And I think what I'm at least hearing from a lot of people, including moms, even if their kids are fully vaccinated, they're hyper curious on what their school should be doing if there's an outbreak, right? What does cause a school to close down for measles, right? All of these questions people learned about, or all of these approaches people learned about during COVID, and now they're really genuinely curious about how to approach these things for other diseases, including measles. How long do they have to keep their kid out of school if they're unvaccinated but exposed, right? It's 3 weeks. Would that help kind of persuade them to get vaccinated? And so I think that vaccines are obviously incredibly important with measles. There's other tools in our tool belt, and being honest around that and giving people the whole picture, I think will also um, help bring people along for this ride and to help make better informed decisions. So Todd, I kind of went on a tangent there. I don't know if that answered your
No, no,
question.
no. You got that in a little mixture, which is great. I think we have one question left. Chelsea's giving me the nod, so I'm going to jump into for Catherine. This is from a health department representative who's interested in hearing how others deal with the social media frenzy when they even suspect there might be a case out there.
Yeah, it's social media frenzy. It's the media frenzy. I can't tell you how many interviews I have done. Um, you know, my messaging around measles, my messaging around COVID was keep things simple, be real. I mean, be there for your community, um, be open. Um, and you also have to take those horrible social media posts that we get. And I assign staff to give very clear, concise responses. And sometimes we just say, we don't have, this takes more than what can happen on Facebook. Please give us a call, and we give them that option to call the health department to try to answer those questions. I go back to what Caitlin was saying. It's so important to find where people are and not just assume that they don't care or that something else is when they don't want to vaccinate. You have to go to those people and figure out where that common ground is and where you can start that relationship and figure out what they believe in, how that's similar to what our shared goals are, and then build trust and communication from there. I just think that's so key. But
Thank
it's
you.
hard to stay away from the Facebook people. I mean, they say
Yeah.
personal things about me sometimes, and you just have to ignore it.
It is a reality, and it's one that's not going away. So I'd like to try and summarize a bit here for a second because I know we're getting to the end of our time. First off, just huge thanks to all of you for sharing. And again, thank you very much both to Common Health Coalition and Public Health collaboration for communication collaboration for making this possible. I think we've seen about the importance of trusted messengers, the importance of using listening, active listening. I can tell you healthcare providers have a really nasty habit of interrupting quickly and sometimes going right to data and fear. And a lot of this is, as you guys have all said, meeting people where they're at, using best tools in communication, and being authentic, which includes saying when we don't know things too. And in this time, particularly with dwindling resources, partnership, particularly between public health and healthcare, I think is going to be absolutely essential. And using the tools that we've had mentioned and that will be listed here is going to be key in driving us forward. So I'm going to hand this back over to Rebecca and team. I know there's probably a few logistical ass things, but Chelsea and Rebecca, thank you so much, and it's been my honor to moderate as well.
Thank you so much, Todd. Thank you all to our panel, and thank you everyone for joining. A few closeout things. So yes, there's a lot of information in the chat. All of this is available on our website at commonhealthcoalition.org. Under our resources, we have these compiled for you. Again, if you have resources that you would like us to list, please reach out. We're happy, to take a look and do so. And just a couple other plugs. One thing that kept coming up today is obviously this notion of trust. And Caitlin, I'll amplify something Caitlin did with other public health leaders recently. They've been doing these conversations with leaders of the MAHA movement on the podcast, Why Should I Trust You? So if you haven't checked that out, definitely do so. I think based on the questions in the chat, there's a lot of interest right now in that question from all folks. So check it out. And there's also a second webinar today from our colleagues at APHA and the National Academies of Medicine at 4 p.m. That's called The State of the Outbreak. And so we'll drop a link to that registration as well if you just want to continue your day of measles learning. So thank you again. I'll just close with a quick note. Someone once recently asked me what gives me hope right now. And honestly, these kinds of discussions give me hope. We have the opportunity to elevate good work happening across the country, make folks like all of you who are in the trenches serving people to feel seen and not alone in the work, and heard and evolving, right? This is a constantly evolving situation, and we all are evolving with it and how we do this work. And just want to acknowledge that this is really, really hard, but it's our hope through these organizations to bring folks together and turn lessons learned into lessons mobilized, and all in service of people and keeping them healthy. So just wanted to end on that moment of hope during a hard time. And I hope you all have a lovely afternoon. And thank you again to our panelists and Todd for this great conversation. Thank you all.
Thanks very much.